Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. Lanjutan daripada pengumuman daripada Yang Berhormat Perdana Menteri Tan Sri Muhyiddin Yassin semalam berkenaan dengan perancangan melaksanakan program imunisasi COVID-19 Kebangsaan. Hari ini saya ingin memaklumkan bahawa untuk kita menjayakan program imunisasi COVID-19 Kebangsaan ini, satu pasukan petugas khas yang dikenali Badan Bertindak Imunisasi COVID-19 ataupun COVID-19 Immunisation Taskforce CITF telah pun ditubuhkan dan akan dipengusikan oleh saya selaku Menteri Penyelaras bagi program imunisasi COVID-19 Kebangsaan. Struktur CITF ini menekankan kepada pendekatan yang bersepadu seperti mana yang telah pun disetujui oleh Jemaah Menteri, iaitu a whole of society approach, merangkumi semua agensi-agensi dalam kerajaan persekutuan, kerajaan negeri, PBT dan juga badan-badan bukan kerajaan, NGO, sukarela sampailah ke peringkat individu. Untuk kita menjayakan program imunisasi kebangsaan ini, kita memerlukan sokongan daripada seluruh negara, semua rakyat Malaysia, semua penduduk di Malaysia untuk memastikan bahawa seramai mungkin dapat diberikan vaksin COVID-19 untuk kita menewaskan pandemik ini. Oleh yang demikian, struktur CITF ini mengambil kira bahawa pemegang taruh utama dalam program imunisasi COVID-19 ini, iaitu Kementerian Kesihatan Malaysia, diberi sokongan yang padu daripada the whole of government and the whole of society agar Kementerian Kesihatan boleh memberi tumpuan kepada tugas untuk memberi vaksin kepada penduduk di Malaysia. Untuk menjayakan CITF ini, saya telah menubuhkan pasukan pengurusan Project Management Team di bawah Task Force ini. Project Management Team ini akan diselia oleh dua pengarah bersama, iaitu Yang Berbahagia Datuk Dr. Chong Chi Kiong di kiri saya, iaitu Timbalan Ketua Pengarah Kesihatan bagi Kesihatan Awam, dan di kanan saya Yang Berbahagia Lieutenant General Datuk Muhammad bin Abdul Rahman, Timbalan Panglima Tentera Darat. Dengan adanya PMT yang dipimpin bersama oleh Timbalan Ketua Pengarah Kesihatan dan juga Timbalan Panglima Tentera Darat Malaysia, ini dapat membawa satu koordinasi dan juga gerakan sepadu yang membolehkan kita menggerakkan the whole of government and the whole of society untuk menjayakan program National Immunisation Program ini. Untuk sekretariat bagi CITF, kita telah kenal pasti selain daripada Kementerian Kesihatan Malaysia dan juga Kementerian Sains, Teknologi dan Inovasi, Majlis Keselamatan Negara sebagai urus setia bersama untuk menjayakan program ini. Majlis Keselamatan Negara diberikan tugas antara lain untuk menyelaraskan kejayaan program imunisasi COVID-19 kebangsaan bersama dengan kerajaan-kerajaan negeri dan juga kerajaan-kerajaan tempatan, pihak kuasa tempatan, supaya program ini betul-betul dapat dilaksanakan dengan cekap dan dengan efisien sehinggalah ke peringkat akar umbi. CITF telah mengadakan mesyuarat pertama pada 16 Februari semalam, yang mana kita telah memperincikan penyelarasan bidang tugas, struktur kerja dan juga perancangan keseluruhan program imunisasi COVID-19 kebangsaan. Dalam mesyuarat tersebut, antara lain MKN telah membentangkan kertas kerja kaitan dengan penyelarasan di peringkat kebangsaan, negeri dan daerah. Jadi kita ada struktur COVID Immunisation Taskforce ini bukan hanya di peringkat kebangsaan tetapi juga di peringkat negeri sampailah ke peringkat daerah, kerana pelaksanaan program ini mestilah dilaksanakan sampailah ke peringkat daerah. Menerusi COVID Immunisation Taskforce, perkhidmatan kesihatan yang merangkumi bidang tugasan pengurusan logistik vaksin, pendaftaran, mengenal pasti kategori penerima vaksin, pemantauan pasca vaksinasi, pentadbir vaksin, pusat imunisasi di fasiliti KKM dan pengurusan sumber manusia akan diselaraskan dengan perkhidmatan bukan kesihatan yang bertanggungjawab bagi pengurusan logistik, utility, tempat letak kereta, ICT, peralatan bukan ICT, dokumentasi, rekod dan pendaftaran, pengurusan maklumat geodata raya, komunikasi strategik, pentadbir pusat vaksin di fasiliti awam, pengurusan pengangkutan penerima vaksin, pengurusan sumber manusia dan juga bahagian sukarelawan. Pasukan badan beruniform iaitu PDRM, ATM, Jabatan Bomba dan Penyelamat serta Angkatan Pertahanan Awam Malaysia juga akan terlibat sepanjang program imunisasi COVID Kebangsaan berlangsung. Bagi tujuan pentadbiran, bilik gerakan CITF telah diwujudkan di Blok F1, Pasal F, Precinct 1, Putrajaya. Saya buka kepada soalan untuk rakan-rakan daripada media.
Afternoon, YB. Joseph from Reuters here.
Yes.
You mentioned yesterday about how the government intends to deal with excess vaccines on using them on security personnel and volunteers should they not be used. But has the government also secured sufficient medical supplies such as low dead space syringes? Because we're looking at a situation in Japan where they likely had to throw out millions of doses because they ran out of the syringes.
Yeah, we have made, as announced by the Minister of Health, Datuk Sri Dr. Adham, we have made arrangements for the procurement of enough low dead volume syringes to be used for the Pfizer vial. Just for background, the Pfizer vial requires LDV syringes to be used in order to extract 6 doses. If you use the normal syringe, you can only get 5 doses. Some countries have encountered problems because they were not able to extract the extra 1 dose from the vial. We have made the order, and we have made the order, and we have also secured enough LDV syringes. We're hoping for the delivery that some of the deliveries have been made, and we're hoping for more deliveries as we roll out the first phase.
Thank you.
Good afternoon, YB. Ashrita here from Code Blue.
Yep.
I have 4 questions. Firstly, what are the potential problems that you foresee happening once the vaccine is rolled out? Second is, when will the vaccine dashboard go live? Is it on February 26? And what data will be featured? Third one is, how many Pfizer doses will be distributed to each state from the first batch of the Pfizer shipment? Lastly, who are the exact frontliners besides healthcare workers and security staff that will be included in the first phase? Will delivery riders or cashiers or those in the hospitality industry will be included in the first phase? That's all. Thank you, YB.
Yeah, sorry, I'm going to have to ask you to repeat your first question. I forgot. You had 4 questions just now.
Yeah, so the first question is, what are the potential problems that you foresee?
Okay, yeah. So as far as challenges are concerned, the first one will be obviously logistics. We are managing a nationwide campaign here, and we will have to ensure that the logistics, especially of the Pfizer vaccine, which has to be stored at minus 70 to 80 degrees Celsius, is seamless to ensure that there's no wastage of the vaccine. We've given a lot of thought into the logistical movements of the vaccines. And obviously, we will start on the 21st when the Pfizer vaccine comes, where it will be distributed throughout the country. As far as the dashboard is concerned, I will update you when the dashboard is ready. It's likely that we will put up a public dashboard sometime in March, once we are happy with the system and once we're happy with the initial rollout of the first phase. As far as the where the vaccines will be sent and how many vaccines will be sent where, we will update you once we finalized those details. On who exactly the frontliners are, we just had a meeting and discussion on who the frontliners are. We are preparing a risk assessment framework to ensure that those who receive the vaccines in the first phase are really those who are at risk of being exposed to the virus in undertaking their duties and jobs. So apart from the medical personnel, about 300,000 from the health sector, the remaining 200,000, we are still going through the list to ensure that based on risk assessment, these individuals are really those who are frontliners who are exposed to infection.
Hi YB, Annabelle from Malaysia Kini here. I have 3 questions. The first one is, if I'm not mistaken, I think pregnant women and also nursing women are not allowed to take the vaccine in Malaysia. Please correct me if I'm wrong. I'm just wondering what is the reason for this? And because I believe pregnant women in the US have been vaccinated, and as pregnant women are at no lower risk of contracting COVID-19. Just wondering if why, and if there's any plans to change it. That's my first question. The second question is about variants. So the EU recently added a anti-variant clause into their vaccine supply deals to make sure that they get access to the upgraded shots, right? So are we also doing that with our vaccine supply contracts? Are we looking to upgrade our contracts? I know they've already been signed. I know you mentioned earlier that we will want to get the upgraded shots, but how are we going to do that? And my third question is related to variants also. Let's say that the COVID-19 vaccine is something that we need to do yearly in the future, right? Like a flu shot or something like that. Will the government, or has the government discussed whether the government will also give it for free in the future for Malaysians and also non-citizens? Yeah, those are my 3 questions. Thank you.
Thank you. On the first question about contraindication and the list of people who we will advise against taking vaccines, we are still updating based on the data that we continue to get from other parts of the world. When we are certain about, for instance, pregnant women, then we will, KKM will announce that whether or not pregnant women will be able to take the vaccines. For now, it's still under consideration, and we will make an announcement soon. Secondly, on the vaccine variant clause, there is in the existing agreement with Pfizer such a clause. When I negotiated, I ensured that if there was an upgrade based on new variants, then our existing contract would cover vaccines that are upgraded or new kinds of vaccines from Pfizer in light of mutations and variants. It's similar with the other vaccine contracts as well. We've secured contracts which will enable us to get upgraded vaccines in light of variants and mutations. On the third question, whether or not the government has discussed whether we will provide free vaccinations should the virus become endemic and it becomes something that we need to take every year. We've not had that discussion yet. We are monitoring very closely around the world, especially in countries where they have accelerated vaccinations later this year, whether or not the vaccines will have to be re-administered, whether the virus looks to be endemic, as in it continues to stay in the community. At that point, we will discuss the longer term support that the government will give Malaysians as well as those residing here on how we tackle this virus on a longer term. Yeah.
Bagi sedikit mengenai pemastian berkenaan dengan pertimbangan untuk mendapatkan vaksin daripada Johnson & Johnson, adakah telah pun didaftarkan dengan NPRA? Dan soalan kedua adalah kita faham bahawa penerima suntikan vaksin pertama akan menerima suntikan kedua. Namun adakah mekanisme untuk memastikan bahawa dos vaksin ini tidak dicuri ataupun dijual secara haram untuk memastikan bahawa penerima pertama suntikan itu akan menerima suntikan dos kedua?
Untuk perolehan daripada Johnson & Johnson, Jemaah Menteri telah buat keputusan berdasarkan kepada SURE daripada Jawatankuasa Jaminan Akses Vaksin untuk kita beli vaksin tersebut. Berdasarkan kepada vaksin itu merupakan vaksin 1 dos dan bukan 2 dos, dan juga rundingan berkenaan dengan maklumat klinikal yang nampak setakat ini sangat positif. Jadi kita masih lagi dalam proses rundingan, dan dalam masa yang terdekat saya difahamkan Yang Berhormat Datuk Seri Dr. Adham akan menandatangani kontrak untuk kita memperolehi vaksin daripada Johnson & Johnson, dan selepas itu barulah dapat kita hantar ke NPRA untuk penilaian. Berkenaan dengan 1 dos dan 2 dos ni, kita ada dasar di bawah Jawatankuasa Jaminan Akses Vaksin, iaitu 1 dos dan 1 reserve. Maksudnya bila kita terima vaksin, kita kena simpan 1 dos untuk yang telah menerima dos yang pertama. Dan kita tidak seperti mana yang berlaku di negara-negara lain, contoh di United Kingdom, di mana mereka telah melanjutkan tempoh untuk menerima dos yang kedua AstraZeneca daripada sebulan sampailah sekarang ini 9 minggu hingga 12 minggu. Sebab pendekatan di United Kingdom adalah untuk memberi seramai mungkin sekurang-kurangnya 1 dos. Tapi di Malaysia kita tak mengambil pendekatan yang sama. Kita mengikut apa pengeluar vaksin telah sarankan, Pfizer, iaitu 21 hari selepas dos pertama. Oleh demikian, dasar kita adalah 1 dos, 1 dos reserve. 1 dos reserve itu akan disimpan di pusat simpanan vaksin, yang mana pusat simpanan vaksin ini adalah pusat-pusat di bawah Kementerian Kesihatan Malaysia, dan pusat simpanan vaksin ini akan kita hantar, dan tadi saya pun telah dapat persetujuan daripada Menteri Dalam Negeri, kita akan hantar polis untuk menjaga keselamatan vaksin-vaksin di pusat simpanan vaksin, ya. Dan saya percaya polis dan juga Angkatan Tentera Malaysia, Timbalan Panglima ada di sini, akan membantu bukan hanya di pusat-pusat simpanan vaksin, tetapi juga dalam kita menghantar konvoi-konvoi ke seluruh negara membawa vaksin ini, sebab vaksin ini menjadi barang yang sangat-sangat bernilai sekarang ni.
Hi YB, Xingying from BFM here. I've got 3 questions. The first one is about foreign workers. I understand the government has agreed to inoculate this group of people as well. But will it be mandatory or voluntary for these people? Will they have to register? And if so, how is the government going to make sure that they receive the info to get vaccinated? What is the criteria for them? Second question is on frontliners that will be vaccinated in phase 1. Will they also need to register, or is it automatically that they will be called forward to get the vaccine because they already have the data stored with the public health and private health databases? And then for the third question is about NGOs and community leaders. You've said that the CITF will engage with them to ask them to help spread awareness, go to the ground. What is their role? And what is their role going to look like? What are they going to be asked to do? Thank you.
Thank you. The first question on foreign workers, it will continue to be voluntary, as it is with everyone else under the National COVID-19 Immunisation Program. But what we will do is I've asked the Ministry of Home Affairs and the Ministry of Human Resources to come up with the implementation plan for reaching out to foreigners and foreign workers. For foreign workers who are documented, we will be working together with their employers to ensure that the employers can furnish us with their details so that we can make appointments for these documented foreign workers to receive their vaccinations efficiently and comfortably. For undocumented foreign workers, we will come up with an implementation plan on how we hope to reach out to undocumented foreign workers. We will be reaching out to foreign embassies, we'll be reaching out to international organizations, to civil society organizations, to non-governmental organizations to assist us in reaching out to these undocumented foreigners. to bring them out and to get them vaccinated with the assurance that we will not be apprehending them or detaining them. I think that's the most important message that we need to send out, that they can come forward freely and be confident that the government will vaccinate them and not detain them. So that's an implementation plan that's still being worked out by the Ministry of Home Affairs in close consultation with the task force. The second question was for the frontliners. Yes, the frontliners have been identified, especially the health frontliners. 300,000 of them have been identified through the Ministry of Health's internal database. We have reached out to them, and now we are working out the appointments management system so that we can tell them when and where they will have to show up to receive their vaccination. So for the first phase, we have largely identified everyone who comes from the health sector, the frontliners from the health sector. We are now going through the list of those who come from the non-health sector, for instance, from immigration, police, the armed forces, and other essential frontline services. And we will be informing them very soon on whether they have been chosen and where and when they will be vaccinated. As far as NGO and community leaders are concerned, we need them to assist, apart from the first point earlier, which is on foreign workers and undocumented migrants. We also need them to assist with one, reaching out to communities which may not have access to information, for instance, in deep interior areas, or for instance, some Orang Asli settlements. So we will need them to assist us in reaching out to these areas, helping us to register these communities who perhaps have no access to information about the National Immunization Program. That's one. Secondly, is to assist us also in increasing vaccine confidence. And this is really where we need NGOs and community leaders to help us. We can have a communications plan at the national level, but advocacy on the ground is very, very important for these people to work with the communities and say the vaccines are safe. The vaccines, we need to vaccinate as many people as possible so that we're all safe. So we'll be identifying a few NGOs and opinion leaders, key community leaders, to even be part of the task force, so that they can assist us in crafting the right outreach to ensure that we increase vaccine confidence, especially in marginalized communities.
Hi, YB. Joseph from Reuters again.
Yeah.
If I may segue just a little bit, Malaysia does already have plans to produce vaccines locally via Pharma Niaga, and we also understand that there are a couple of companies that have applied for halal certification for the Chinese vaccines. So does Malaysia have any plans to potentially become a hub for halal COVID-19 vaccine distribution for other Muslim nations? And if you have any idea how many companies have expressed interest or applied for halal certification? Thank you.
Many vaccine producers have approached us in wanting to position Malaysia as a hub for Southeast Asia and also the other Muslim markets around the world. Because of our well-respected and stringent halal certification, this is seen to be a value add for many vaccine manufacturers. I've been discussing, for instance, with the Russian Sovereign Wealth Fund about investing in a manufacturing facility in Malaysia for not just COVID-19 vaccines, but other vaccines and other pharmaceuticals. So this is very exciting because from this pandemic, we've seen an opportunity in trying to boost the local pharmaceutical and biotechnology industry. Other than the Russians, I've also discussed briefly with India about investing as well in manufacturing capacity here for Malaysia to be potentially identified as a hub for Southeast Asia, as well as for the Muslim market. And of course, as you know, there are a lot of private companies who've tied up with Chinese vaccine manufacturers who've invested in manufacturing capacity here, but none of them have been approved or licensed by NPRA yet. That's, of course, the big caveat here. But I feel that, of course, as long as they get the necessary regulatory approvals and they are seen to be safe they adhere to good manufacturing practices, then Malaysia is certainly seen to be one of the countries which can potentially become a hub for Southeast Asia as well as the other Muslim economies.
Hi,
Yep.
Mel here from Channel News Asia.
Yep.
What about the refugees? Yeah, what is the plan for them? They are considered a vulnerable group, I suppose. And secondly, who decides, who gets what vaccine? I suppose the Prime Minister will be getting Pfizer since it's the first to arrive.
Yeah, thanks, Mel. For the refugees, we will have to work together with IOs like UNHCR as well as NGOs to reach out to the refugee community. Again, as with undocumented migrants, we must build trust with these communities so that they can come forward willingly and freely so that we can administer vaccines to them. And I think it's very, very important that, as I said earlier, this is not just a government-wide approach, this is a society-wide approach. So I'll be discussing with IOs and NGOs very soon in coming up with a plan for the refugee community and how we can reach out to them and how we can secure vaccinations for them. On the question of what vaccine people receive, I've received this question many times, and the policy of the government is that whatever vaccine has been approved by the NPRA is safe and efficacious. In that sense, you won't be able to choose your vaccine. You'll be allotted a time, a place, and a date for your appointment, and whatever vaccine is available there, I assure you, will be a safe and efficacious vaccine. Yeah.
Jadi ada tak Perdana Menteri berkongsi apakah perasaan atau apa yang dirasakan menjadi individu pertama menerima vaksin dan mengapa Perdana Menteri ingin menjadi individu pertama? Itu pertama. Soalan kedua, semalam ahli parlimen akan harapan meminta supaya dimasukkan dalam jalan kuasa program imunisasi jadi pengumuman.
Yang Amat Berhormat Perdana Menteri hanya berkongsi dengan Jemaah Menteri berkenaan dengan perbincangan yang PM telah mengadakan dengan Presiden Jokowi daripada Indonesia. Presiden Jokowi telah memaklumkan kepada PM waktu beliau menerima vaksin daripada Sinovac. Beliau tak rasa apa-apa, cuma rasa mungkin letih sikit, itu saja. Dan Perdana Menteri telah menjangkakan mungkin itu juga apa kesan sampingan yang dijangkakan. Ya, namun demikian saya pun telah tanya Yang Amat Berhormat Perdana Menteri supaya Yang Amat Berhormat sama ada Yang Amat Berhormat telah bincang dengan doktor peribadi sebelum menerima vaksin, dan PM telah maklumkan bahawa doktor peribadi beliau telah memberi kebenaran, green light, to go ahead with the vaccination. So insyaAllah ia akan berlangsung dengan lancar nanti. Kenapa Yang Amat Berhormat telah memilih diri sendiri antara pertama yang akan menerima vaksin? Ini kita telah bincang di peringkat Jemaah Menteri, adalah untuk memberi keyakinan kepada orang lain, bahawa vaksin ini selamat. Ada yang masih lagi ragu-ragu, walaupun vaksin ini telah pun diuji puluhan ribu orang di seluruh dunia. Malah sekarang ini bukan hanya diuji, telah pun diberi kepada 100 juta lebih di seluruh dunia, dan tidak ada apa-apa kesan sampingan yang serius yang telah dilaporkan yang disebabkan oleh vaksin ini. Jadi di Malaysia kita nak bagi keyakinan bahawa kalau ketua kerajaan sendiri telah mengambil vaksin dan tidak ada apa-apa kesan yang buruk dan sebagainya, ini boleh meningkatkan lagi keyakinan orang ramai kepada vaksin. Dan yang kedua, of course, adalah berdasarkan kepada penilaian risiko. Penilaian risiko, Perdana Menteri berjumpa dengan ramai orang setiap hari, dan ini melibatkan satu keadaan di mana beliau terdedah dan orang lain juga terdedah kepada beliau. Sebab itu kita juga telah buat penilaian risiko dan didapati bahawa mereka yang sentiasa bersama dengan orang ramai seperti ahli politik dan sebagainya boleh dikira sebagai antara senarai keutamaan. Soalan kedua tadi apa? Saya telah baca kenyataan akhbar daripada Pasukan Petugas daripada Pakatan Harapan. Saya tidak ada masalah untuk kita berjumpa dari masa ke semasa dan untuk kita minta pandangan daripada mereka. Tetapi saya ingin maklumkan bahawa dalam struktur CITF di peringkat negeri, contoh di Negeri Sembilan, di Selangor, ini sememangnya melibatkan Pulau Pinang, ini sememangnya melibatkan ahli-ahli politik daripada Pakatan Harapan sebab mereka adalah kerajaan negeri. Jadi tidak timbul mereka tidak terlibat. Memang CITF struktur negeri, saya akan berunding dengan Menteri Besar Selangor, Menteri Besar Negeri Sembilan, Ketua Menteri Pulau Pinang. Untuk 2021, kita masih lagi fokus kepada keperluan negara kita sendiri. Ya, nak jadi hub halal untuk negara lain ni dia satu perancangan jangka masa panjang. Untuk keperluan sekarang adalah untuk kita mendapat bekalan yang cukup untuk negara kita. Tetapi pada masa yang sama, sekiranya sebagai contoh syarikat-syarikat yang nak bawa vaksin daripada luar ni, dia ada perjanjian tambahan untuk menubuhkan kilang, untuk buat R&D dan sebagainya. Ini kita galakkan, ya, sebab kita percaya COVID ini bukanlah the last virus. Akan ada pandemik ataupun akan ada virus lain. Akan sentiasa diperlukan vaksin untuk virus-virus lain. Jadi ini adalah peluang bagi syarikat-syarikat farmaceutical dan bioteknologi tempatan untuk kita meningkatkan nilai tambah. Dan untuk akan datang juga, saya ingin melihat kita ada kepakaran ini. Sebab sekarang ni kalau kita tengok di Malaysia, kita terpaksa beli semua vaksin kita daripada luar. Kita tidak ada kapasiti pembuatan tempatan. Ya, jadi saya harap dengan pengalaman kita beli vaksin ni, dengan ada R&D, dengan kita ada teknologi transfer, pemindahan teknologi, kalau berlakulah, ya, nauzubillah, kalau berlaku apa-apa pandemik untuk tahun-tahun akan datang, kita ada kapasiti sendiri untuk menghasilkan vaksin.
Minister?
Yep.
Yeah, I'm Isan from GG Press. I just want to confirm whether the free COVID-19 vaccine will be given to expatriate as well.
Yes, the COVID-19 vaccines will be provided free to expatriates also. If there's nothing else, I just wanted to close by saying that we will let you know what time the vaccines arrive on Sunday, the 21st. We have an indicative time, but once I can confirm that, then I will let the media know. We can have a small media coverage of the vaccines arriving, just so that people are comfortable and assured that the vaccines indeed have arrived. It will be a closed, secure environment because it's at the mass cargo terminal in KLIA. So I'll get my press team to make arrangements with media representatives who you want to send, and please send your names and information early so that we can have coverage of the event. I will also be updating another PC just before the commencement of the program on the 26th with further details about where the PPVs are, the pusat pemberian vaccines are, and also a better breakdown for you on the frontliners and the list of frontliners for phase 1. Any questions in the meantime, you can pass along to my office and we'll try to get the answers for you. Thank you very much. Terima kasih.